Hey, I'm Dr. Kethu. I'm a gastroenterologist, former assistant professor at Brown University Medical School, and a marathon runner. Today, we are diving into some little known secrets of the medical field that your doctor might not discuss with you. It doesn't mean that we are hiding some secrets from you, but they don't come up unless you ask your doctor. These are the secrets that can really make a difference in your health and understanding of the medical world. Hit that follow button for more health and wellness tips. Okay, ready to get started? Let's roll. Secret number one is overdiagnosis or misdiagnosis. Sometimes we diagnose conditions that might never cause harm. About 20% of diagnoses fall into this category. This can lead to unnecessary treatments and anxiety. But more serious is wrong diagnosis or missing or delaying diagnosis. After all, as humans, we all make mistakes, but doctors' mistakes can cause significant harm or even death. More than 100,000 Americans a year get a missed, delayed, or wrong diagnosis that can lead to permanent harm or even death, like missed cancers, heart attack, stroke, clots, and infections. These numbers may be even higher. For example, a doctor might diagnose you having flu, but you may really have something more serious like sepsis, meningitis, or Lyme disease, which can look like flu in the beginning. Some experts say that when they examine bodies after death, which is called autopsy, they find that up to 90% of the time, doctors might have diagnosed the wrong illness while the person was alive. Out of those 40%, about 10 to 12% are really serious, some resulting in avoidable death. How do we know this? Because autopsies, which are examination of the body after death, reveal the true cause of death. But only 6% of deaths undergo autopsies. This means that in many cases, the real cause of death remains unknown and it's literally buried. There are at least 15 conditions where doctors can get the diagnosis wrong, including, for example, irritable bowel syndrome, fibromyalgia, multiple sclerosis, Parkinson's disease. There is a long list of conditions. Okay, I don't want you to start doubting if every recommendation given by your doctor is wrong or somehow false. But if something doesn't sound right, don't hesitate to ask questions about your doctor's recommendations, whether it is medications or tests or even treatments. Be polite and respectful of their time, but also don't be intimidated or apologize for asking questions. Ultimately, it is your body and your health is at stake. All right, secret number two is doctors missing crucial details in test results. Let me tell you about Sarah. She went to her doctor because she had been experiencing severe headaches for several weeks. The doctor ordered an MRI to check for any brain issues. Good news is no signs of a brain tumor or aneurysm. However, the radiologist noticed an abnormality in her thyroid and recommended a follow-up ultrasound. But Sarah's doctor focused only on the clear MRI results, told her that everything was fine, and suggested she take some painkillers for headache. The headaches were gone. A year later, Sarah returned to the doctor with persistent fatigue and a noticeable lump in her neck. This time, a biopsy showed that she had advanced thyroid cancer, which had spread to nearby tissues. Unfortunately, the cancer was too advanced for effective treatment. If Sarah's doctor had paid attention to the radiologist's recommendation, they might have detected the thyroid cancer early when it was still treatable. Cases like Sarah's are not rare. In 2009, a study by Cornell Medical College found that doctors failed to inform patients about significant findings about 7% of the times, and in some practices it can be as high as 25%. How do you deal with this? No news is not always good news. It can be bad too. So if you don't hear from your doctor, call them. Don't assume that your tests are normal. Always ask for copies of all your medical reports, including blood test results, x-rays, CT scans, MRIs, any scans that you have done or any tests you have done. Take time to read them thoroughly. Don't hesitate to ask your doctor about any abnormalities or any confusing terms that you don't understand. If something doesn't seem right or you are unsure, seek a second opinion from another doctor. This ensures that all potential issues are addressed and nothing is overlooked. Secret number 3 is that even the best doctors don't know everything. Sometimes they might not be aware of the latest research or treatments. Let me tell you about Mark. He had chronic sinus infections and severe headaches. His first ENT doctor suggested over-the-counter allergy medication, which didn't help him much. Another doctor prescribed strong antibiotics every time he had an infection, which he ended up taking 10 times in a year. So he was really frustrated. Mark saw a third ENT specialist who recommended using a saline nasal rinse and a specific type of humidifier to keep his sinuses moist. It worked like a charm. It just goes to show that no doctor can know all the latest research and treatment. So if the current treatment is not working for you, look for alternative options. New treatments are discovered and FDA approved every week, and some doctors might not be aware of them. Keep exploring until you find a solution that fully satisfies you. If you're having surgery, ask your surgeon what is their complication rate and how many surgeries have they performed so far, and ask if there are other alternatives to surgery. Don't assume that just because your doctor sent you to a particular surgeon, you need surgery and that he or she is the best for that particular surgery. Now, secret number 4. Doctors often prescribe medications for chronic conditions, but lifestyle changes may be the first best step. When you are prescribed a medication, always ask for the alternatives. We don't have to treat every condition with medication. Sure, it may be a quick fix, but it doesn't mean that it is always the only option. For instance, if you have high cholesterol, ask if you can try better diet and exercise before going on medications. This might sound basic, but its impact is big. Never underestimate the value of a second opinion. It can provide new perspectives on your diagnosis and treatment options. According to a Mayo Clinic study, up to 88% of patients seeking a second opinion get a new or refined diagnosis. Now, secret number 5 is hospital-related risks. Yes, hospitals are places of healing, but they can also be breeding grounds for infections. These hospital-related infections are also called nosocomial infections. This is the 6th leading cause of death in the United States. The Centers for Disease Control in the US reported that hospital-acquired infections affect 1 in 30 patients every day. Most of these infections are preventable. So how can you prevent them? Simple measures like hand washing or advocating for yourself can dramatically reduce your risk. You may not have control over everything that happens in the hospital, but here is an example. It may make a big difference. Urinary tract infection, because of having a catheter, which is the flexible tube inserted into the bladder to help drain urine, is very common when you're in the hospital. If you had a catheter for several days, ask if you still need it or if it needs to be changed. Another common mistake in the hospital that you can avoid is getting wrong medications from nurses in the hospital. These mistakes are more common than you think. Always ask the name of the medication and why you are getting this medication so that you will have an extra layer of safety. Secret number 6 is surprise medical bills. Your medical bills can give you sticker shock and not always transparent. Many doctors, hospitals, clinics may be out of network with your insurance. For example, your surgeon may be in network, but the anesthesiologist or pathologist may be out of network with your insurance. Always ask. The last one, secret number 7, and very important one, is physician burnout. Doctors often face high levels of stress and burnout, which can affect their work. A study published in 2018 in Journal of American Medical Association found that 72% of physicians experience emotional exhaustion and 67% have overall burnout. Another study linked burnout to a twofold increase in unsafe care and unprofessional behavior. So it is important to be aware of these issues, seek multiple opinions whenever necessary. How do you handle this? Be mindful that you typically only get 10 to 15 minutes with your physician, sometimes even less if they're running late. To make the most of your visit, arrive on time, start by clearly stating your main concern, how quickly it worsened, and any other related symptoms. Bring a list of all your medications you take, including dosages. Write down any questions you have beforehand so that you will be very efficient in asking those questions. Being well prepared helps your doctor to be more efficient and allows them to provide better and safer care as they'll be more relaxed and less stressed. So, there you have it, some insider secrets from the medical field that could change how you think about your health and medical care. Remember, your health is your greatest asset. Take care of it and don't be afraid to ask questions. Thanks for joining me today. If you found this video helpful, please like, share, and subscribe for more insights into health and wellness. And if you have any questions or topics you would like me to cover, drop a comment below. Let's keep this conversation going. Until next time, stay healthy and informed.